The bony orbit, or eye socket, is a skeletal cavity that surrounds the eyeballs along with nerves, blood vessels, and muscles. Viewing the skull anteriorly, or toward the frontal region of the body, are four primary segments that shape the orbit called walls. The walls of the orbit are termed the superior wall, the inferior wall, the lateral wall, and the medial wall. The apex of the eye is positioned at the posterior or the back of the orbit. The base, also called the margin or orbital rim, is situated anteriorly. Within the orbit, 7 unique bones form the walls: the frontal bone, the sphenoid bone, the palatine bone, the ethmoid bone, the zygomatic bone, the maxillary bone, and the lacrimal bone. The frontal bone, stemming from the Latin word frons, which means front, is stationed on the anterior portion of the skull. The frontal bone is vital for supporting and protecting the nervous tissues that form the brain. Several muscles of the head articulate with the frontal bone. The most major of these muscles are the temporalis, which helps to close the mouth, and orbicularis oculi, which closes the eyelids. The sphenoid bone forms the base of the cranium, posterior to the eye and inferior to the anterior part of the brain. One of the main functions of the sphenoid bone is that it aids in development of essential anatomical structures. Many foramina, or openings, and fissures, or narrow openings, are located in the sphenoid bone that carry nerves and vessels. The palatine bone, located anterior to the sphenoid bone, houses the teeth and important foramina located in the posterolateral region of each palatine bone. These foramina give passage to palatine nerves and blood vessels. The ethmoid bone is a porous bone that forms the midfacial region of the skull. It contributes to the molding of the orbit and separation of the nasal cavity from the brain. The hollow cavity that connects the skull with the nasal cavity is called the ethmoid sinus. Sinuses help to filter, clean, and humidify the inspired air. Interestingly, some migratories have magnetite, which is a mineral in their ethmoid bone. This gives them the ability to sense the Earth's magnetic field. The zygomatic bone is one of the most irregular shaped bones of the skull and forms the lower outside edge of the orbit and the prominence of the cheeks. The zygomatic bone supports the main jaw muscle, which is the strongest muscle in the body in proportion to its size, the masseter, which allows chewing food and speech. The maxilla forms the upper jaw by fusing together two irregularly shaped bones along with the median palatine suture, located at the midline of the roof of the mouth. The alveolar process of the maxilla holds the upper teeth and is referred to as the maxillary arch. The lacrimal bone is considered the most fragile bone of the face and one of the smallest bones in the body. It is located on the medial wall of the orbit and has a gland that functions in lacrimation or crying. These landmarks are called lacrimal fossa, which form the depression on the anterior inferior portion of the bone. The optic canal is bounded medially by the body of the sphenoid and laterally by the lesser wing of the sphenoid. This transmits the optic nerve or cranial nerve number 2 and ophthalmic artery into the orbital cavity. The superior orbital fissure is located between the lesser and greater wings of the sphenoid in the posterior portion of the orbit. There are 4 cranial nerves that transmit through the superior orbital fissure. The trochlear nerve, or cranial nerve 4, innervates the superior oblique muscle. The ocular motor nerve, known as cranial nerve 3, innervates the medial rectus, superior rectus, inferior rectus, inferior oblique, and levator palpebrae muscle. The abducens nerve, cranial nerve 6, innervates the lateral rectus muscle. The inferior orbital fissure is formed by the sphenoid and maxilla. The trigeminal nerve, V2, the inferior ophthalmic vein, and sympathetic nerves travel through the fissure. A common fracture, known as a blowout fracture, occurs to the floor of the orbit. This is caused by traumatic force and can result in surgery. In conclusion, the bony orbits are structures that hold and protect one of the most valued senses, sight. This film was produced for the biology department at Saddleback College.